I just saw a patient today who is doing really well with her recovery. She's been clean for 3 years now. She has a job. She's happy, some depression and anxiety, but overall things are going really well. I hadn't seen her for a while because she'd been seeing some other people, but when I asked her about anything going on, she said, well, I'm still having really bad nightmares almost every night and breaking out in sweats, and it relates to some PTSD stuff that she'd had back when she was using and in her earlier years with an ex-husband and some other things. And it was disturbing her, of course, and I was sort of stunned that she hadn't started working more on it, because when I asked her, well, what is she doing about it? She said, well, not really anything. So she's not seeing a therapist, and she's going to some recovery meetings, some 12-step meetings, but she hasn't got a sponsor and she hasn't worked the steps. And I started encouraging her to start doing some of those things and to see a professional therapist, because there's a lot of help out there for people who have PTSD or any kind of hang-ups from the past. Part of recovery is about getting rid of the drugs and the alcohol and then moving on with your life and really recovering and healing a lot of the trauma from the past. Some of the stuff is trauma that we've done ourselves to other people, so there's guilt and all sorts of emotions with that. And some of it is trauma from the past that was done to us, either in a childhood that was maybe not perfect and where there wasn't unconditional love, which, most of us grew up with in families that it wasn't unconditionally loving. So there's some old feelings of low self-esteem and anger maybe, and resentment and fear and all sorts of other emotions. And those things can get better. Those things can get better dramatically. There's a lot of professional help out there. There's one technique called EMDR that a lot of therapists are using for PTSD now, and it can be very effective. Working the steps and letting go of the past and forgiving yourself and forgiving others is a huge part of it. And then, of course, with protracted recovery, you do activities and things that you don't regret, and so you don't create even more problems as you go forward. So it's all a process of moving on and healing from the past. So I hope she takes the advice and follows through with those suggestions and really puts a lot of effort in, because like most things in life, the more effort you put into changing and healing, the more you get out of it. Turns out your mother was right.